The Omicron wave continues to loosen its grip on South Dakota, with the health department reporting fewer cases and hospitalizations.
And with the coronavirus on the decline all over the country, the CDC is starting to relax some masking guidelines. I spoke with Sanford Health today about how this impacts you. COVID-19 cases are going down, but some people are still wearing masks in Sioux Falls, and some businesses are still asking you to put a face covering on. However, according to new guidelines released from the CDC on Friday, 70% of Americans can now stop wearing masks.
I think overall it's really good news.
Sanford Health's chief physician, Dr. Jeremy Cowles, says that the CDC's recommendation is based on two factors.
As long as you're not having high disease transmissibility and a real shortage on beds, they're saying it's safe to make sure to not wear masks in the community at large, which I think is good news.
How is Sanford doing with hospitalizations?
Thankfully, hospitalizations, especially from COVID, have fallen off fairly nicely since about the middle of January. And so we're sitting in a spot right now that is, for all the world, looks very similar to what our normal January or February would look like.
According to this map provided by the CDC, much of South Dakota is in low community spread, shaded in green, and medium spread, shaded in yellow. There are still several counties, though, that are in high transmission areas, shaded in orange. The CDC strongly recommends people in those areas continue to wear a mask in public.
I would say, number one, if you have a medical condition that means that your immune system isn't quite normal, that would be a time that I would wear a mask fairly consistently. The other time, I would say that if you're recovering from a COVID illness, there are clear CDC guidelines that would say you should be staying home for the first part of that illness, and you should be wearing a mask for days 5 through 10. And those rules still apply.
No matter your area of community spread, health officials still say you need to get vaccinated and boosted against COVID-19. And we also reached out to Avera Health for comment. You can read their response under this story on KELOLAND.com.